Hello, we're here today to speak about a campaign for an All-Ireland National Health Service. We're in Armagh City, outside the North-South Ministerial Council building. This is the building in which ministers from the north and the south of Ireland come together to discuss matters such as health on an all-island context. And we're calling on them to take notice of this campaign. I'm going to speak to Patricia Campbell from the Independent Workers Union and to Tommy McKerney from the Peadar O'Donnell Socialist Republican Forum about the campaign. Patricia, can you just introduce yourself, please, and tell us about the campaign for the All-Ireland National Health Service?
Okay, Patricia Campbell, Independent Workers Union. I'm also a nurse. I think this campaign is very, very important. Also the COVID, the pandemic COVID-19 has exposed the deficiencies in the health service in the north.
Thank you, Patricia. Tommy, the Peadar O'Donnell campaign, or the Peadar O'Donnell Forum, is heavily behind this campaign. Could you explain why to us, please?
Well, I think it's self-evident what's needed at the moment is a new, different approach to health on this island. We need an all-Ireland health service. We need an all-Ireland health regime. What we're experiencing today is the Minister for Health, North and South, having a Zoom conference to talk about issues that they should have been talking about years ago. As my colleague Patricia Campbell has said, the deficiencies in the health service are being only now exposed by the emergency arising from COVID-19. But listen, we're talking about a small island, we're talking about a relatively small population, and it's extraordinary that we would not have one health service. What we're seeing is the outfall, once again, of the partitioning of this island, two different jurisdictions, two different approaches, and at the moment, with a population one-third of in the north of Ireland, one-third of what's in the Republic of Ireland, with 3 to 4 times as many cases of COVID, 3 to 4 times as many deaths arising from COVID. This is a scandal, and the answer is quite simple. We need one All-Ireland health service, one All-Ireland health regime, and no longer have simple Zoom conferences between two ministers for health. Let's have one service, address these crucial, critical issues before this crisis reaches out of control.
Thank you very much, Tommy. Patricia, you are a frontline health worker, you work in the health service, you've witnessed firsthand the impact that this pandemic has had on a service that was already struggling before the pandemic arrived.
Well, I think that most people are witnessing the impact. What we're seeing is patients being treated in the back of ambulances. This would be inconceivable 20 years ago. It's an absolute disgrace that people are being treated. There was a time when there was an outcry about people waiting on trolleys in hospital corridors. But now people are actually being treated in the back of ambulances. This is an absolute disgrace. And I'm also want to pay special homage to the frontline workers, to the staff that are working under such adverse conditions.
Thank you, Patricia. Do you think the health service on either side of the border was prepared in any way for such an outbreak? I mean, these things can happen at any time. I mean, should preparations not have been in place for just such a scenario as this?
Absolutely. I mean, we've known about COVID-19 since last March and before that. We're now coming into flu season. We're now coming into another lockdown. It's very, very worrying. And I would like to add that I read where the chairperson of the British Medical Association said that ethical and moral decisions would have to be made by people who are not trained to make them, and that they shouldn't have to make such decisions in a civilized society. I mean, it's breathtaking, and I think it's time for people to take the initiative and join this campaign and demand health for all, north and south, cross-border health for all.
Thanks, Patricia. Tommy, you've heard what Patricia had to say and the devastating impact that this has had on frontline services. Where are the Peadar O'Donnell Forum taking the campaign, or what are the next steps in this campaign for an All-Ireland Health
We
Service?
have to energise the people to look for what is needed and what they're entitled to. Let me just say this, that the oldest reason for a state is to protect and defend its people and its citizens. By that yardstick, this northern state has failed dismally. It is a failed political entity and has long been. When confronted with an emergency and the welfare of its citizens, with the welfare of its people, it has failed to protect them in the most basic, fundamental aspect of its duties. So therefore we have to examine this problem in its entirety, and look at the reasons for it and what's happening. We're going to energise the people to call for an All-Ireland Health Service, recognising the need to address the fundamental underlying issues that have led us to have these two failed political entities, but certainly this failure of a health service, most spectacularly, most dreadfully in the north of Ireland. But let's keep in mind that the health service south of the border is not an example for anybody either. It is a two-tier health service where the wealthy can benefit better than the less well off. But we are experiencing also the creeping privatisation of the National Health Service. What for long was one of the jewels in the crown of the British state, and there wasn't many, I can assure you, but this was one of them. But since the onslaught of the Thatcherite neoliberal agenda, there has been a continuous, ongoing reduction in the contribution budgetary to the health service, and running parallel with that has been the invidious implementation of privatisation in the health service. What we're seeing, and this is one of the problems we're faced with, is privatisation right across society, but particularly in the health services north and south. And only yesterday we were reassured, believe it or not, that there would be a facility made, whether Brexit results in a deal or not, that would facilitate the transfer of private patients north and south to deal with certain issues. This is bizarre that the NHS would pay private healthcare centres in the Republic for operations that should be carried out here in the north of Ireland, and vice versa, that people in the Republic would be asking the HSE to pay for basic health facilities in private facilities in the north. The private profit has no part to play in providing for the health of the citizens of this country. And let's keep in mind that we're talking about Ireland, the island, not, as the Free State politicians are now deciding to call Ireland, the 26 county entity. We don't have 26 counties in Ireland. We have a 32 county Ireland. It's a geographic entity. So let's talk about this geographic entity in its 32 counties to provide the health